is a very simple acronym to identify the signs of a stroke easily. It's called FAST. The F stands for facial drooping, and it's usually always on just one side of the body. So the side of the body that's affected is opposite of the brain. So if it's your left brain that's having, or your right brain that's having a stroke, your left side of your body will be affected. Yes, but it's not usually both sides. It's one or the other. So you have the facial drooping, you will have arm weakness, and it could be leg weakness, both. And those really vary in degrees of how much weakness there is. It could just be simply having trouble grasping something like this pin here, or it could be complete paralysis where you can't move that side at all. The speech difficulties range from not being able to talk at all to having difficulty just, you know what you want to say, but you can't get it out. Or the speech comes out kind of garbled, and there could be some confusion with that also. The T stands for time. So the sooner we can get to a stroke, the faster we get there, we can treat it. We want you to call 911. We do not want anyone to drive themselves to a hospital because the symptoms can progress
I hear people say
rapidly.
give people an aspirin or something with that.
An aspirin is recommended after we know what type of stroke it is, because there's two different types of stroke. There's what's called an ischemic stroke, where there's usually a blood clot that's blocking off the artery and not the brain, the blood's not getting to the brain. There's also called a hemorrhagic stroke, where there's actually bleeding in the brain. So we don't want them to have aspirin in that case. So we first want to know what type of stroke, then we'll give aspirin or not. But if we get them here in a very timely manner, within 3.5 hours of their symptom onset, we can treat them with an IV medication that can reverse a lot of their symptoms. Because in a stroke, it is the #1 debilitating disease that we have. It's number 5 in death, but it's the #1 in disability.
And that's what usually your blood pressure?
Blood pressure is one of the biggest risk factors. Smoking, cholesterol, all the risk factors that go along with heart disease are also stroke related. So this worksheet here, this is for someone who's already had a stroke, but it talks about what you can do for your risk factors, and blood pressure is the #1 thing. Monitoring your blood pressure, making sure you're taking your medication if you're required to take medication, controlling your cholesterol through either diet or medication if the doctor prescribes it, watching your blood sugar. Diabetes is a risk factor also. Be active, watch what you eat, try to eat healthy, lose weight if that's something that you need to do, and by eating healthy and being active, that will occur too. No smoking. That's just a given for pretty much any health issue. And then the last thing is to talk to your doctor about whether an aspirin is recommended. So those are the main things. It is, this one I believe talks about, so the high blood pressure is the #1 enemy, and it also talks about stroke targets people by their color, and blacks are 2 times at a higher risk for a stroke.
And his bottom number has been high, and they want him to take blood pressure medicine, but he doesn't want to take it.
He really, if it continually is high, he really needs to get that under control, because that's also a risk factor for blacks. They tend to have higher blood pressure, and getting that under control can tremendously reduce your risk for stroke. So, do you have any other questions?
No, thank you very much. I want to take your blood.